Thank you for enrolling in the Elysian Health Program. Today, we want to educate those of you who are new to the program and refresh those that are currently on the program. We will go through the program, the employee benefits, and some frequently asked questions and answers. Elysian Healthcare provides transformative insurance benefits supported by a NCQA-certified population health management provider, incorporating Elysian Healthcare, Recuro Health, Health Advocate, and BMD tax attorneys. The program also includes a fully insured hospital indemnity policy. Here, you see the hospital plan schedule of benefits. In addition to the health management claim payment received in payroll each pay cycle, employees are also eligible to receive a hospital indemnity payment when a claim is filed. You can see here the different plan levels, with Plan 3 being the lowest premium and benefit, and Plan 5E being the highest premium and benefit. Here is an example of a paycheck for an employee not on the program, and a paycheck for an employee on the program. On the left side, we see the employee being paid $1,000 each week with a take-home pay of $831.58, not being on the program. Now on the right side, we see the weekly paycheck of the employee on the program earning $1,000 in gross income per week. This employee is on the highest premium, and you can see that indemnity plan premium is deducted from the paycheck pre-tax. That leads to a reduction in the employee's tax liability. Then the indemnity claim payment is put into the employee's check post-tax, leading to a take-home pay of $849.95. So being on the program, this employee is saving $18.37 per week, or $956.28 per year. Now let's take a look at your user experience. Members have unlimited access to a national network of licensed doctors via phone or video chat for the member and their family 24 hours a day, 7 days a week. Providers can help with a range of health management and medical needs. There is a $0 copay for many services, including virtual primary and urgent care, prescriptions for certain common medicines, health management coaching, and lab and genomic screenings. With our virtual primary care, members have access to top primary care physicians to provide personalized care at any time. Some of the most common conditions treated are seen here. With a dedicated physician at home labs, health risk assessment, and integrated care. The entire healthcare experience is made much more user-friendly. Here are some of the highlights of the program. 70% of doctor visits can be conducted virtually, with an average of a 9-minute waiting time to speak with the doctor. At-home labs and same-day appointments lead to members avoiding the emergency room and saving hundreds, if not thousands. We have made at-home lab tests very easy for members. It is a matter of simply ordering the kit, collecting the sample, shipping back, and reviewing the results with your physician. These labs are generally geared toward overall wellness as well as genomics. This allows members to get in front of any potential hereditary issues. With our virtual urgent care, members get access to doctors for treatment of medical concerns 24 hours a day, 7 days a week. Some of the most common conditions treated are seen here. With 24-hour access to primary care coordination, easy prescriptions, and the entire virtual suite, members enjoy a much more personalized healthcare experience. This leads to a 61% decrease in your healthcare costs. With only 9-minute average wait times, 1 in 3 emergency room visits can be conducted virtually. Members also have access to same-day prescriptions with $0 out of pocket. With our virtual behavioral health, members have access to comprehensive therapy, counseling, psychiatry, and medication management. Some of the most common conditions treated are seen here. Similar to the previous slides, our behavioral health component also features a dedicated physician, health assessment, and easy prescription pickup. Roughly 75% of people experience some form of a mental health condition, and over half of adults do not get treatment. Now members can see a provider within 48 hours, with 86% of members reporting promising results. With the way medicine is going, it is no shock that 2/3 of behavioral health care has gone virtual. With our prescription benefit, patients get the medication they need at lower cost. Some common medications are seen here. Members receive their prescription benefit card with a broad prescription list. Medication can be delivered to a member's home using our extensive pharmacy network and user-friendly portal. Our program puts a focus on proactive management of members' health. With our health management platform, members have a personalized wellness experience. Our program features a personal Pathfinder assessment, educational workshops, assistance with goal setting, guidance on positive habit building, personal coaching, meal planning, daily health tracking, and optional wellness challenges. Our digital coaching platform is what members use to complete their simple healthy activity for each month. Members receive communication typically via email to encourage and guide the digital coaching experience. Engagement ensures employees stay compliant with the program. To supplement the digital communication, members will receive something like this in the mail from time to time. It is just another reminder for each member to complete their simple healthy activity for the month. For members that have questions, we have representatives available 24 hours a day, 7 days a week. Via phone or email, we have bilingual representatives available. For members that have tax-related questions, we offer BMD tax consulting. This tax advisory is free with the program and offers unlimited tax assistance from tax professionals and discounted personal tax filing services. Here are some frequently asked questions and answers. Why would an insurer pay us to participate in health management activities? This is the case for multiple reasons. Health and well-being impacts the nation's health and economy. Obesity alone costs the U.S. healthcare system $147 billion each year. It also leads to common health issues like heart disease, diabetes, and various forms of cancer. In 2020, health spending in the U.S. reached $4.1 trillion. For every $5 spent in the U.S., one of those dollars was spent on healthcare. 92% of Americans have some form of healthcare coverage. Insurance companies pay trillions each year to cover those costs. Prevention really is the key to reducing these costs. Does the Elysian policy replace my healthcare coverage in any way? No. This supplemental plan is separate and apart from any other coverage you may have. If I am auto-enrolled, will it lower my take-home pay? No. Employees are only qualified to be auto-enrolled if they see an increase in their take-home pay under the plan. How does my pay increase? The premiums are taken pre-tax, which lowers your taxable income and your taxes withheld. Then your claim payment is added back in after tax, which often results in a slight pay increase. If my tax liabilities are reduced, how will this affect my tax returns? Everyone's tax situation is unique. That is why we offer free tax consulting through BMD Consulting via their tax advice line for all enrolled employees. If I don't qualify for other employee benefits, how will I be enrolled in this plan? This supplemental program is separate and apart from major medical benefits. You may qualify even if you don't qualify for other benefits. What is the plan's effective date? Your plan is effective beginning the week of your first pay deduction. Do covered family members also have to complete the activities in the Recuro health portal? No, when the employee completes their PQA, plan qualified activity, it qualifies their family members for the specific plan benefits. Do we have to pay for the biometric screenings? No. Costs associated with the biometric screenings are covered by the plan premium, which is deducted from your pay, pre-tax. Again, we want to take this opportunity to thank you for being part of the Elysian program. If you have any other questions or would like to discuss further, please come by our table. Thank you.